Good afternoon. This is Dr. Adamson coming to you talking about another topic that everybody deals with or will deal with eventually, and that's cholesterol. Specifically high cholesterol, and more specifically a high low density lipoprotein cholesterol. So cholesterol is an important molecule. It helps maintain production of hormones and it helps the central nervous system stay healthy. Cholesterol as a class of molecules is called lipoproteins. There are 5 types of cholesterol lipoproteins: chylomicrons, very low density lipoproteins, low density lipoproteins, intermediate density lipoproteins, and high density lipoproteins. Guideline directed therapy targets LDL, HDL, and triglycerides, along with total cholesterol. We'll talk about triglycerides another day. Treatment goals are based on your medical history and your calculated cardiovascular risk score. The higher your risk score, the lower your LDL goal. Well, how do we figure out what our risks are? Well, we look at the ASCVD. That is your atherosclerotic cardiovascular disease score. And how is that calculated? It's calculated with your age, your sex, your race, your systolic blood pressure, diastolic blood pressure, total cholesterol, HDL, LDL, a history of diabetes, smoking history, whether or not you're on treatment for hyperlipidemia, hypertension, and or aspirin. We put this data in and we come up with a score. And that score lets us know what goal of LDL we should shoot for. Some individuals have a goal of LDL less than 160. Others have a goal of less than 130. Others have a goal of less than 100. And others have a goal of less than 70, or as low as we can get it. So when we talk about hyperlipidemia and its treatment, there really are 2 different populations. We talk about primary prevention and secondary prevention. Today I'm going to talk about primary prevention. And primary prevention once again starts with a detailed history, going in to see your doctor talking to you about your history, and then plugging your numbers into this ASCVD risk score. And what normally pops out is a score that tells us we should do one of 2 things. We should institute lifestyle changes. We should institute lifestyle changes and medications, or we should do some type of risk stratification in order to determine whether or not a patient needs a statin or aspirin. So I want to talk to you about one specific group in particular. The specific group in particular is who I see most commonly, which are individuals between the age of 40 and 75. And if they have no known heart disease or peripheral vascular disease, then we shoot for an LDL somewhere between 70 to 190. All right. Then we go and we determine whether or not they have diabetes. If they do not have diabetes, then we calculate their ASCVD risk score. And for individuals who have a risk score of less than 5%, which is less than 1% per year, we consider those low risk. And all we do is talk about lifestyle reduction, and their goal LDL is less than 160. And individuals who have a risk score that gives them a 5% to 7.5% risk, we call them borderline risk. We discuss whether or not statin therapy is appropriate. And in those individuals, we would want their LDL goal to be less than 130. For individuals who are intermediate risk, which means somewhere between 7.5% per year, but less than 20%, which is 1% to 2% per year, we discuss lifestyle, medications, and other ways to reduce their risk. And for those individuals who are high risk, we talk about greater than 50% LDL reduction or a target LDL of less than 70. And these targets are hard targets, and we try to get patients there as quickly as possible, understanding that many patients do have statin allergies and it's difficult to attain these goals. So when we talk about our statins, we talk about 3 different types of statins. We talk about low intensity, moderate intensity, and high intensity statins. When we're talking about risk reduction of greater than 50% in our highest risk populations, we're talking about atorvastatin, 40 milligrams to 80 milligrams daily. Rosuvastatin, 20 milligrams to 40 milligrams daily. And we work our way down from there. In my clinic, I always try to address hyperlipidemia from a holistic standpoint, which means that I address exercise, diet, and medications. Most individuals can get their LDLs to target who are in the primary prevention category with just exercise and diet. But the statin medications, along with other medications like Zetia or the PCSK9 inhibitors like Praluent and Repatha, can help dramatically lower LDL. And in some cases, these medications have also been shown to reduce myocardial infarction, stroke, and death. So I wanted to talk to you briefly about cholesterol today and let you know that it's an important part of your health, and it's a part that should not be overlooked. And that in order to control your cholesterol, I believe that it's 3 parts to it: diet, exercise, and medication therapy. Thank you so much for tuning in today. You take care, and I'll talk to you soon.